wallpaper on laptop. Or
No,
what we have to do
you
for this
need to
assignment?
print out for me an unofficial copy of your transcript. That's all I need from you. I have the degree audit that I will check, just to make sure you're on track. All you need is your unofficial transcript. Does that make sense? Everybody's doing that, right? Because that should be, all right. And I'm gonna finish up with the civility mentor. So everybody did hand me in a civility mentor, yes? Okay, good. All right, so let's continue because time runs away with us all the time. Legal aspects, any questions so far of what I did, if you remember? If I talk about advocating for a patient, what does that mean? I'm advocating for a patient. My patient is supposed to go downstairs and have some kind of invasive procedure, and the patient signs a consent, and now a transport is here to bring the patient to the testing area, and the patient says to me, I changed my mind. Is the patient allowed to change their
Yes.
mind? Yes. So you're the nurse. What do you do?
Report to the provider that.
Before you report to the provider,
Explain the outcome.
you would explain outcomes. Before that, what do you think you want to do?
You ask.
Before that?
You ask them why. You ask them why.
Yeah. Yeah. You just want to understand. So the patient says, I changed my mind, I'm not having it. Okay. Can you share with me why you don't want to do it? What's wrong? Why you have a change of heart? You just want to seek to understand what is their thought process behind it, okay? So once you understand what their thought process is, yes, then you could potentially explain the risks of not doing it, the benefits of doing it, and if there are any alternatives. Is there something the patient can do instead? Then you would call the provider, and then you would tell the provider everything. But the provider will ask you,
Why?
why, exactly. So what are you gonna say? I don't know. You can't, you have to know why. So you have to do your due diligence as a nurse and find out why. And then that is called advocating for the patient, okay? Because you're standing up, I respect my patient's wishes, my patient's decided that they don't want to have it done now. Maybe they'll have it done a different time, but right now they don't want to have it done, so you're advocating for them, okay? There's no coercion, there's no bullying, there's no conniving, there's no bargaining. You advocate for your patient. Whatever your patient wants, that's what your patient's going to have. Does that make sense? Okay. So let's look at incident reports now. Remember we talked a little bit about incident reports. For example, patient forgets to ring the call bell and tries to get up out of bed and falls down. That is an incident report, okay? That is something that occurred that should not have occurred. It's out of the ordinary, and it has the result of potentially harming a patient. So if a patient falls, can they potentially be harmed?
Yes.
They could break something, right? So absolutely. So this is not part of the medical record. An incident report is not part of the medical record. It's something that they keep in-house, and it's just the nurse documenting facts, okay? Facts. Patient stood up, patient's legs felt weak, patient fell on the floor, okay? You don't blame anybody, any person, any entity. There's no discipline involved. You just state the facts. If you really think that there might be a potential injury with the patient, the physician will examine the patient. If they need to order any x-rays, they'll do that as well. And they will address it accordingly. This, like I said, is not part of the patient's chart. Okay, a sentinel event. Now, a sentinel event is a very big deal, because what happens in a sentinel event, there is a very, very, very serious untoward outcome or patient death.